Welcome to another session of Inside Washington Hospital. I'm your host, Dr. John Thomas Mehigan. Methicillin-resistant Staphylococcus aureus, better known as MRSA or MRSA, is a type of bacteria that is resistant to certain antibiotics. You've probably heard about it in the media recently. MRSA infections are generally mild and affect the skin with small red bumps that may be mistaken for pimples, boils, or spider bites. These bumps can quickly turn into deep, painful abscesses that require medical attention. Treated early, MRSA infections can be kept from spreading, but left untreated, MRSA infections can travel deep into the body, causing infection of the bones, joints, lungs, heart, or surgical wounds. And that can lead to more serious problems, even death. But there's no need to panic. There is a need to be aware of the problem and to take care to avoid situations that might expose you to MRSA infection. Dr. John Iocco is Medical Director of Laboratory Services at Washington Hospital.
MRSA is transmitted from person to person. MRSA can also be transmitted from surface to person. People who are at great risk for it have irritated their skin. High school athletes are at risk. People who are big people, overweight people, large people, tall people, more surface contact. It's proportionate to that. So skin is the most common way that community-acquired MRSA is transmitted, skin to skin.
MRSA can be a particular problem for us at Washington Hospital and for hospitals and healthcare facilities in general where the infection occurs frequently. Patients who undergo invasive medical procedures or have weakened immune systems are particularly susceptible.
Well, now we're looking at patients who are at high risk, people who have other disease, who are going into intensive care units or cardiac care units, and screening them. And we're screening them with a new test that looks for the genetic material in the Methicillin-resistant Staph aureus. And we can get those results within 2 hours. And patients who have MRSA in their nose are put on contact isolation. So their chance of spreading it is eliminated. They're under close surveillance, and if they develop an infection, we're right there.
Besides healthcare-associated infections, MRSA is also a danger to otherwise healthy people in the community at large. MRSA can spread just about anywhere there is likely to be skin-to-skin contact or shared items or surfaces that have come into contact with the infection. Involvement in team sports increases the risk because the bacteria that cause staph infections quickly spread through cuts and skin-to-skin contact and through the sharing of towels and athletic equipment. Children are at greater risk because their immune systems aren't yet fully developed. Staph infections like MRSA can spread rapidly after entering a child's body through a cut or a scrape. The good news is that MRSA is preventable and treatable, especially when it is detected early. Washington Hospital is at the forefront of this prevention effort through our participation in the Institute for Healthcare Improvement's 5 Million Lives campaign.
Methicillin-resistant Staphylococcus aureus, better known as MRSA, which is a very dangerous infection.
Washington Hospital has also made a very forward-looking investment in state-of-the-art technology that reduces the time for clinical detection of MRSA dramatically.
And this is a device that we'll be bringing to Washington Hospital that will give us results on MRSA testing within 90 minutes as opposed to waiting 3 days.
The importance of this new technology cannot be underestimated. GeneXpert gives us the ability to detect MRSA significantly earlier, and that can mean we can prevent much more serious consequences. We spoke with Shabnam Hashemi, Infection Control Coordinator for Washington Hospital's Patient Care Services Division, about the hospital's approach to MRSA and to infection control in general.
So the bottom line is that early detection is the key to prevent MRSA infections down the line, and the key to early detection is the technology that we just acquired, which enables us to do that, to do the early detection so that we can prevent MRSA from becoming a life-threatening illness down the line for the patients.
Cepheid, based right here in Silicon Valley, is a worldwide leader in the development of diagnostic tools based on genetic testing. The GeneXpert system developed by Cepheid is the latest addition to Washington Hospital's arsenal of infection control strategies. Dr. David Persing is Chief Medical and Technical Officer for Cepheid.
The thing that makes me excited about this technology is that we've taken an incredibly sophisticated molecular diagnostic test involving multiple complex laboratory steps and put it into this little plastic cartridge. And essentially it's like a plasma TV, incredibly sophisticated technology, but you press the on button and it goes on and you change the channels. And this technology allows an operator to basically take two little reagent bottles, squeeze them into holes in the top of the cartridge, takes material from a swab and puts it in this hole, and then closes the lid and put it into this machine over here, which runs the test and generates results in anywhere from a half hour to about an hour and 15 minutes, depending on the test. Basically, what has happened is we've democratized this diagnostic technology to make it possible for almost any healthcare worker to run.
Because of its compact design, the GeneXpert technology can be easily implemented into Washington Hospital's clinical laboratory.
Washington Hospital has the newest technology for the most rapid diagnosis of MRSA. It's unique in the Bay Area. It's one of the few hospitals in the country that is promptly diagnosing MRSA infection in patients who are at high risk. And this is very important because these patients can be monitored very closely. They're placed on contact isolation that prevents them from spreading the bug to another patient.
It allows for prospective planning versus retrospective reaction. Once a patient's identified as a carrier, everybody goes, oh my goodness, we have to implement barrier precautions. Well, it's already 3 days too late. They've had 3 days of transmission opportunity during that period. Much better to prospectively know what the patient's status is.
So this is an extremely important advance, and it is the future, and it's presently here at Washington Hospital.
There are several simple things you can do to protect yourself and your children from MRSA and other staph infections. It's mostly a matter of practicing good hygiene. First of all, keep your hands clean by thoroughly washing with soap and water or using an alcohol-based hand sanitizer. One simple way to make sure you are washing your hands thoroughly enough is to use the Happy Birthday method. Continue to scrub your hands vigorously long enough to sing the Happy Birthday song in your head. That should be sufficient to kill most germs, including MRSA. Keep cuts and scrapes clean and covered with a bandage until they're healed. Avoid contact with other people's wounds or bandages. There are also several things you can do around the house to help reduce risk of infection. Using a bleach water solution, wipe down surfaces, door handles, faucets, and anything that's shared between people. Wash towels and linens frequently in hot water. Avoid sharing personal items like towels or razors. Keep fingernails short and clean underneath. Don't wear false fingernails, which can trap bacteria. Avoid multiple piercings and tattoos. Anything that breaks the skin is putting the individual at risk.
The thing that's so sinister about MRSA is you can be a carrier of it on your skin and in your nose, and you're as effective a reservoir for MRSA transmission if you're a carrier as if you're a patient with an open draining skin lesion.
If you suspect you may have a staph or MRSA infection, see your doctor right away. If an antibiotic is prescribed, take all the doses, even if the infection appears to be improving, unless your doctor advises otherwise. Some infections can be treated by draining the abscess or the boil, thereby eliminating the need for antibiotics. But remember, only a healthcare professional should do the draining.
The most important thing to realize is that through awareness, through practicing of good hand hygiene, through respect for prompt attention, getting prompt attention for any kind of cutaneous skin sore, we really can't control this. We can manage this. This is something that man's ability can deal with, and I think that the instrument we have here is a quantum jump forward in preventing it in the hospital setting.
Detecting and treating MRSA can be a costly proposition for everyone. But if we can detect just one case of MRSA each year at Washington Hospital, we will get our full value from our investment in testing. But rapid detection of MRSA isn't just about saving time or money, it's about saving lives. People infected with antibiotic-resistant organisms like MRSA are more likely to have longer and more expensive hospital stays, and they may be more likely to die as a result of these infections. That's why we're taking steps at Washington Hospital right now to reduce the danger, to increase patient safety, to take advantage of the latest early detection technologies, and to do our part in the fight against MRSA and other drug-resistant infections. I'm John Thomas Mehigan. Thanks for watching Inside Washington Hospital.